The sacral plexus is a network of nerves that is primarily located in the pelvis, specifically in the posterior abdominal wall and the pelvic cavity. The plexus is positioned on the posterior surface of the piriformis muscle, a flat muscle located in the buttock region. It is formed by the convergence of the anterior rami of the spinal nerves S1, S2, S3, and S4, which originate from the sacral region of the spinal cord. It also receives contributions from the lumbar spinal nerves L4 and L5. Commonly known as lumbosacral trunk, as discussed before. So, these are the illustrations of sacral plexus you will come across in most texts. In the second illustration, you can also see the S5 spinal root and coccygeal nerve, which is sometimes also contribute in the formation of sacral plexus. See how both the L4 and L5 are shown to be part of the sacral plexus here. This explains why the lumbar and sacral plexuses are often studied as being one and collectively called the lumbosacral plexus. Rather than being strictly divided into anterior and posterior divisions, the branches of the sacral plexus tend to follow a more complex pattern of innervation. It is possible only through its various branches. Let's explore the branches of nerves that originate from the sacral plexus. The sacral plexus gives rise to several important peripheral nerves, and just like the lumbar plexus, although its primary function is sensory and motor innervation of lower limb, the plexus also gives nerves branches to pelvic region and perineum. To learn about the branches of the sacral plexus, we can divide them into two groups: major branches and smaller branches. I will use two separate illustrations to make it easier for you to memorize these nerves. Let's start with the major branches. The first branch of the sacral plexus is superior gluteal nerve. This nerve arises from the sacral plexus, specifically from the ventral rami of L4, L5, and S1 spinal nerves. After its origin, the superior gluteal nerve emerges through the greater sciatic foramen, above the piriformis muscle, which is one of the deep muscles of the buttocks. It then passes deep to gluteus maximus, between the gluteus medius and gluteus minimus muscles. This nerve has only motor function and no sensory function, meaning the nerve is responsible for the innervation of muscles such as the gluteus medius, gluteus minimus, and tensor fasciae lata. These muscles are essential for hip abduction and maintaining pelvic stability during walking, running, and other lower limb movements. If we talk about its clinical significance, damage or compression of the superior gluteal nerve can result in a condition known as superior gluteal nerve syndrome. This can occur due to trauma, compression, or other underlying conditions. Symptoms may include weakness or paralysis of the gluteus medius and minimus muscles, leading to a characteristic gait pattern with Trendelenburg limp. During walking, when the body is supported on the left foot, the right unsupported side of the pelvis droops, causing inability to walk with right foot. This is called positive Trendelenburg sign. That is all about the superior gluteal nerve. Just below it is another nerve called the inferior gluteal nerve. The inferior gluteal nerve arises from the ventral rami of L5, S1, and S2 spinal nerves. It is responsible for innervating certain muscles in the gluteal region, particularly the gluteus maximus muscle. After its origin, the inferior gluteal nerve emerges through the greater sciatic foramen below the piriformis muscle. It then passes inferiorly and deep the gluteus maximus. Its branches innervate the gluteus maximus muscle. The gluteus maximus is responsible for various actions, including hip extension, hip external rotation, and assistance in maintaining an upright posture. Just like the superior gluteal nerve, the inferior gluteal nerve does not have a sensory function. Although it does have an important motor function, as it innervated the gluteus maximus muscle. Because the gluteus maximus is an anti-gravity muscle, it is essential for actions that require elevating the body against gravity. It is particularly important for movements such as rising from a seated position, climbing stairs, and running. Damage or compression of the inferior gluteal nerve can lead to weakness or paralysis of the gluteus maximus muscle. When the gluteus maximus is weak or paralyzed due to damage or compression of the inferior gluteal nerve, these activities can become challenging, in severe cases impossible. Injuries or conditions that impact the inferior gluteal nerve can result in functional limitations and may require appropriate diagnosis and treatment. Now that you know about these two nerves, let me ask you a question. Why do you think they are named superior and inferior gluteal nerves? The terms superior and inferior used to describe the gluteal nerves are based on their anatomical positions and the muscles they innervate within the gluteal region. The superior gluteal nerve is named as such because it is located above or superior to the piriformis muscle. On the other hand, the inferior gluteal nerve is named because it is located below or inferior to the piriformis muscle. Okay, let's move and look at the other nerves of sacral plexus. Let's get this one out of the way. Here's the sciatic nerve. It is a nerve that frequently comes up in both academic and clinical studies. It is often recognized as the largest and longest nerve in the human body. Its significance makes it a topic that students and healthcare professionals encounter regularly throughout their educational and professional journeys. I will get into the details of this nerve later. For now, you just need to know that the sciatic nerve can be described as two individual nerves bundled together in the same connective tissue sheath. These two nerves are called the tibial nerve and common peroneal nerve. These nerves usually separate at the apex of the popliteal fossa, but in some individuals, it can occur as soon as the sciatic nerve leaves the pelvis. Moving on. Here is the nerve called posterior cutaneous nerve of thigh, also called the posterior femoral cutaneous nerve. This nerve originates from the roots of the S1 to S3 spinal nerves. The posterior cutaneous nerve of the thigh runs down the back of the thigh, just beneath the gluteal fold. The posterior cutaneous nerve of thigh leaves the pelvis via the greater sciatic foramen, entering the gluteal region inferior to the piriformis muscle. It descends deep to the gluteus maximus and runs down the back of the thigh to the knee. It provides sensory innervation to the skin on the posterior aspect of the thigh, as well as the skin over the popliteal fossa. This nerve carries sensory information such as touch, temperature, and pain from the aforementioned areas back to the central nervous system. The posterior cutaneous nerve of the thigh is primarily a sensory nerve, and it does not have any motor function and is solely responsible for sensory perception. While the posterior cutaneous nerve of the thigh is not commonly associated with specific clinical conditions. Damage or injury to the posterior cutaneous nerve of the thigh can result in sensory disturbances, such as numbness, tingling, or pain in the affected areas. Causes of injury can include trauma, compression, or entrapment of the nerve. And another major peripheral nerve that branches off from the sacral plexus is called the pudendal nerve. It is a crucial nerve that innervates the pelvic region. The pudendal nerve is a major nerve that originates from the sacral plexus, specifically from the S2 to S4 nerve roots. It provides innervation to the external genitalia, perineum, and certain pelvic floor muscles. This nerve leaves the pelvis through the greater sciatic foramen, then re-enters via the lesser sciatic foramen. It moves anterosuperiorly along the lateral wall of the ischiorectal fossa and terminates by dividing into several branches. The pudendal nerve has both sensory and motor functions. In terms of motor function, the pudendal nerve innervates the muscles of the pelvic floor, including the external anal sphincter and the muscles that control urination and defecation. It plays a crucial role in the voluntary control of these muscles. On the sensory side, it carries sensory information from the external genitalia, including the clitoris, labia, perineum, and the anal region. It provides a sense of touch, pain, and temperature to these areas. Damage or injury to the pudendal nerve can result in various symptoms depending on the affected area. Sensory disturbances, such as numbness, tingling, or pain in the genital or perineal region, may occur. Motor dysfunction can lead to difficulties with urinary or bowel control, as well as sexual dysfunction. The pudendal nerve is of particular importance in obstetrics and gynecology, as well as in urology. It is involved in the process of childbirth and is also a target for certain medical interventions, such as pudendal nerve blocks used for pain relief during labor. A mnemonic that can be helpful in remembering the major branches of the sacral plexus goes like sum, Irish, sailor, pesters, penny. This mnemonic represents the following nerves: superior gluteal nerve, inferior gluteal nerve, sciatic nerve, posterior cutaneous nerve of thigh, and pudendal nerve. Earlier I mentioned that the sacral plexus gives off major and smaller or minor branches. To look at the other smaller nerves that arise from the sacral plexus, I'm going to switch to this more detailed illustration of the sacral plexus. The smaller nerves are as follows. First, we have the nerve to quadratus femoris and inferior gemelli. These muscles are located in the posterior hip region. These muscles are deep muscles of the gluteal region and play an important role in hip stability. Here is the nerve to obturator internus. It supplies both the obturator internus and superior gemelli. If we move downward, other smaller nerves that supply the back oof thigh can be seen here. These are nerve to the long and short head of biceps femoris. You can see that nerve innervation in both heads comes from two separate divisions. Next up are nerves to semimembranosus and to semitendinosus. Here is the nerve that supplies the ischial head of adductor magnus. These muscles collectively form the hamstring muscle group and work together to extend the hip, flex the knee, and assist in rotational movements of the leg. That is all about the anatomy of the sacral plexus and the branches of nerves that originate from it. I will talk about the sciatic nerve next.
Watch our medical videos anytime and anywhere. Download sqadia.com app now.